Well, thanks everybody for making it. Again, this is the K12 webinar. For those of you who don't know, we have these every other month. We try to advertise and make sure you know what each webinar is about. They have something to do with neurosurgeon-scientists and leadership and things of that nature. Today we have a great group. We're going to talk about career arcs for a neurosurgeon scientist, and I think we have three great panelists: Dr. Carter, Dr. Chiocca, and Dr. Curry, who have had some similar pathways, but also some divergent pathways in terms of where their careers have gone. And I think we're going to hear some about that and how you might prepare and think about where you might be taking your career. So I'll introduce Dr. Carter, and then he'll introduce the other two, if that's okay. Dr. Carter is the chair of the Department of Neurosurgery at Mass General Brigham now. He's the William and Elizabeth Sweet Professor of Neurosurgery at Harvard Medical School. He's also the co-lead of the MGH tumor program, and a wonderful leader in academic neurosurgery, organized neurosurgery, and really look forward to Bob, you leading this webinar, and I'll turn it over to you. Thanks.
No, that's great, Greg, and thanks to the NRCDP program for your organization of this K12 seminar series. I was really excited because we have two incredible panelists tonight whom I know well, but I think have distinguished themselves through their academic careers in neurosurgery. With a brief introduction, we have Dr. Nino Chiocca, who is the executive director of the Center for Tumors of the Nervous System at Mass General Brigham, and also co-chair of the executive committee for the Mass General Brigham Cancer Institute. And we also have Dr. William Curry, professor of neurosurgery at Harvard Medical School, the Wydotis endowed professor and chief medical officer of Mass General. And these two individuals have been inspirations to me in their careers. And I thought it would be fun for us to go back in time and dissect a little bit about their experience and how their journey has brought them to their current roles. So I have a number of questions, but one of the things that I read one time was, begin with the end in mind. And that seems almost impossible when I look at the career arcs of these two incredible and distinguished individuals, because I don't believe either of you could have possibly imagined your current roles when you were first starting out. So here's my first question that I'd like to give to both of you, and maybe we'll have Nino kick off first and Will to follow, and then we'll switch it up a little bit as we go along. But one of the things that's impressed me is both of you are distinguished and highly regarded neurosurgeons, but you also have now in your current roles a real system perspective. You have a view outside of neurosurgery even in the way you are accomplishing your current work. So I wonder if you could tell the group, many of whom are early in their careers, tell us a little bit about your present role, and tell us about how the portion of your work inside of neurosurgery influences your perspective outside of the neurosurgery in the system aspect of your role as you work across and outside of our specific field to develop your current influence. So maybe we'll turn it over to Nino again with just some thoughts about your current role, what it is, and how that perspective, both inside and outside of neurosurgery, comes together to allow you to have more impact, and the same thing for Will to follow.
Well, thank you, Bob, for that question. It's a wonderful question. I think it's a question that relates to collaboration, collegiality, teamwork. And one of the things that we all learn is that it's very hard to achieve nowadays anything on your own, or even with a few of your favorite disciples or favorite people that you work with. You really have to reach out across aisles or work together, because sometimes the best science, the best innovation does come in groups and in teams. In my current role, I've become responsible for trying to figure out how to best interact, collate, coalesce groups of individuals from different specialties, from different disciplines, sometimes even disciplines that we don't think may be that associated with neurosurgery, such as maybe PM&R or others. into providing the best possible care for patients with tumors of the brain, spinal cord, peripheral nervous system. But not only that, how do you bring the science into that? How do you bring the science of clinical trials, the science of innovation, the science of databases and outcomes? I think as scientists, more than neurosurgeons, we learn how to write grants, we learn how to give talks. But if you listen to even the best scientists, each one of their talks or each one of their grants is not just about themselves and their lives, but it's also about collaboration from different disciplines. And I don't think I personally could have achieved anything without collaborating and getting others to participate, sometimes to even lead. In fact, most times even to lead on some of the most innovative ideas that we haven't had. So I think that this is the theme. And I think that the more we learn how to do that, I think the better the advances.
It's a great overview. And I want to come back to that collaboration question in just a moment. But let's turn to Will for a moment, maybe describe a little bit about your role and take on that similar theme.
Sure. No, thank you. And Bob, when you opened by saying something like starting at the end or at the finish, you're completely right that I would have never predicted or imagined most of the steps of my career, and the least of which would be my role, which I've had for 2 years as chief medical officer of the hospital. And just so that people know what that entails, because that job is a little different from hospital to hospital, center to center across the country. I oversee quality and safety in the hospital, patient experience, health equity, provider well-being. And this includes like all of the things like credentialing, privileging, and assessing the performance essentially of our physicians. But if I could sum it up, it's about setting us up and creating the policies and the guidelines and the guardrails and the structures that enable the best clinical product. Like how do we deliver as a hospital within a system, within a larger system, the best possible care to our patients. So it's very, very patient focused and associated with supporting our providers, our doctors, and our APPs, and helping the chairs, actually supporting the chairs as they do that within their departments. So it's a role that I really enjoy, but I also would say that being a neurosurgeon kind of prepared me quite well for, actually. In many ways that Dr. Chiocca just alluded to. When I started, as I was choosing to become a neurosurgeon, as my career within neurosurgery developed both clinically and academically, each step of the way that I wasn't like I didn't have a particular goal for my own role. I was motivated by just improving, right? Just improving either myself as a clinician, improving the way our team in our department and our division of neurosurgical oncology performed, improving patient experience, improving our interdisciplinary relationships, all in the name of better efficiency, better outcomes, and overall like better value. And that's really what we're all trying to do. And you can never do that by yourself, right? It's how do you reach out across to whether it's like nursing or other department leadership, radiology tech. Like how do you work with groups of people, lead groups of people, sometimes take a seat back and let others lead in this kind of matrixed way. That's just part of a career in an academic medical center. And if you just keep doing it, you kind of naturally get asked to do more, and it becomes kind of interesting. So it's very similar to what motivated me to start a scientific career. I had role models who were doing it, and I also saw the need for our patients. I was doing brain tumor work, to have better options, right? Obviously, they still need to have those better options, and it's just kind of like not being satisfied with the current state of the art and wanting to be part of the solution or creating the solutions to like some of these intractable problems that we have.
Yeah, thanks for those responses. One thing that I've picked up in both of your responses is really the power of collaboration and relationship building. And my impression is that can be a little bit of an art form. perhaps asking both of you, as you've developed relationships, whether it's a formal scientific collaboration and you're trying to decide the give and take of who's going to do what in a given project, or perhaps even downstream a little bit when you're thinking about the credit and the associated allocation of resources that come with that collaboration. What are some of the principles that you have begun to develop personally or have developed personally about how to collaborate, how to be a good collaborator, and what do you look for in a relationship? Because I think for many of those on the call or on the webinar today, the collaboration is going to be a big part of their future. So for you, what are the keys to good collaboration, either manifest in your own actions or those of others? And maybe we'll kick that back to Nino and come back to Will for a response to that.
Yeah, so like every human venue or human venture, there's always the potential for collaborations going awry. I think collaboration should happen. But there's also, especially when you first start off, there's always the question that in the end, who's going to get the credit, who's going to get the resources, and that can sometimes become a very difficult conversation, and that's when collaborations go awry. A lot of times depends on personalities, and I always find that collaborations sometimes happen organically. And in fact, sometimes collaborations start off and people realize, our personalities really don't mesh. Let me find somebody else to do this with. I think that's key. You really need to have people that are going to be trust. They're going to assume always good intent, that they're going to think about the ultimate goal, which is to improve the science or patient care. And I always find that the best collaborations end up always being two-way streets. Everybody's going to improve. Everybody's going to get something out of it. It reminds you a little bit about game theory, where, if you work together rather than against each other, you both will gain. And so I think that's true also in science. And so there's various ways of doing this. Sometimes people, will have pre-collaboration meetings to decide things like, I'm going to do this, you're going to do that. I'm going to be first author, you'll be last author, something like that in the paper. Sometimes I find those difficult to manage just because you don't know where the science goes. And you cannot force science into certain things. And so sometimes you get stuck where all of a sudden you realize that if you have a paper or a grant, that most of it is actually not what you originally thought it was going to be. And the people that were going to be the first and last author probably should not be the first and last author, because they really did not contribute much, because that's where the science brought you. So I think there's got to be a give and take with constant communication between the different parties involved, and not to make that happen. In general, I would say 90% of the time, in the end, it gets resolved, especially if there's good science being made and there's a good outcome for everybody involved.
Thank you.
Yeah, those are great points. Great points. And have many experiences both ways, actually. But collaboration, when it works, is like absolutely the richest part of the job, I think. There's some really exciting moments as you're building a collaboration, like at the beginning, and when you kind of like are brainstorming and grooving, so to speak, on an idea, and then you realize that you both can bring something to a project together, and then starting to see it through is just incredibly exciting. Like there's always milestones in a scientific journey, and I find like the idea generation part to be really rewarding, actually. And then you have a lot of work to do, but still that beginning is pretty exciting. And I think particularly for the surgical audience, it's and I'm thinking of some of the collaborations early that I had that I'm lucky that I feel like I had many more that worked than didn't, but those that didn't were when it wasn't clear exactly where what endpoints we were trying to get to, or also what we wanted from each other. So, and I can think of examples where, when I was a young investigator, more senior investigators not from neurosurgery, but from others, like really just wanted me as the person that would deliver the tissue to them, and like weren't interested in our creative ideas or our inputs or even our use of that tissue, for instance. So just be a little bit aware of that, beware of that, and know, try to get an understanding of how everybody can truly synergize, and kind of take it from there. I do think that it is good once you start writing a paper, right? To be clear where one comes into view, what the authorships are up front before actually like the draft gets completed. But there are easy guidelines around that, I do think. But there's almost no project that is as rich without collaboration and without reaching out to people in other disciplines, including mentors.
That's fantastic.
If I can add one thing.
Yeah, please.
It's very interesting because I think what happens in the biological sciences and the medical sciences, where the order of authorship is so important, is unlike what we see in some of the other sciences, like in physics, for example, or mathematics, where it's actually the team gets the entire value of the collaboration rather than the first author or last author. You know, in mathematics, it's alphabetical. Same thing in physics, and in physics, just teams. And I tend to think that in those sciences, it tends to be a little bit less consternation about who gets the credit and more about the final product.
Yeah, that's right. Economics also.
Yeah.
Those are some great thoughts. And I'll just add one little comment there to this theme of collaboration, which is I have personally tended to take a long view of collaboration, which is to say that on any one paper or project, it may not turn out exactly the way I thought it was going to go, but as I've invested in the long term of that relationship, I recognize that, science is more of a marathon than a sprint. Even if there's an incredible early career paper, that's only just one paper. You have to really take a longer view of how you're going to work on that relationship and develop it over time. And I think that does bring it to bear in collaboration, taking that long view.
Yeah, Bob, can I add one thing to that? I agree completely. Yeah. And like Nino said something about like forcing certain things. Don't force collaboration either, right? Collaboration will feel natural, will feel productive. You can tell from the earliest conversations, right? If the environment is right. With your potential co-investigator.
Great thought. So I want to take us back to early days for both of you, and I'm going to start this one with Will. But when you think back, we talk a lot about mentorship in academia and science, but I wonder if you could talk about maybe your earliest influences to think about a research-infused career, because both of you have pursued that. And if you have an example, for example, of a mentor who particularly made a recommendation to you that you might not have otherwise known about or had an influence on you, I'd be curious to hear about that, because I think sometimes we see the culmination of a career in these types of roles that you have, and we think, oh, wow, it was a linear path from A to B. But we actually, when we go back and dissect it, there was considerable zigzag to get there, and there were different influences. So, if both of you could speak to perhaps an early influence, and it may have been a specific mentor or a specific recommendation that you followed that actually led to a new avenue of exploration or development or personal development, I think that would be very interesting to us as a group. So maybe we'll kick it back to you, Will, early on, and talk about those early days.
Bob, thanks. I'm really happy to. And it's almost like a kind setup, since I'm on this panel with two mentors of mine in the world of neuro-oncology. But when I went to medical school, I really had no idea about what like academic medicine was, or being an academician in surgery. I wanted to learn how to take care of sick patients. In like a state-of-the-art care setting at the highest level. That was kind of what I went. And then actually in medical school, I knew that if I wanted to get into neurosurgery, I just had heard that I should do some research. So I spent some time, and I don't know if it's interesting if anybody here knows, with Jam Gajar, who is like a head injury researcher and started something called the Brain Tumor Foundation, and was like taking trauma call all the time, but also had a lab where he was doing translational research and creating the brain tumor trauma guidelines, like the first iteration of those, working with other leaders from around the world in head injury. So in Jam, who was actually just also like a great dynamic person, I got to see like each piece of research, like a basic science lab doing early work in inflammation after a head injury, clinical research and translational work, taking like cytokines, CSF rather, from head injured patients and doing a cytokine analysis. It was very, very eye-opening. And so I spent some time, about a year with him. And then when I came to Mass General, of course, there were people on the faculty like yourselves and Dr. Chiocca, who were like doing the exact same thing in neuro-oncology as well. And, you know, I had some early exposures with both of you. And then I decided that I loved the intellectual challenges associated with making brain tumor care better, which is why I decided to go neuro-oncology. And I worked with Sam Rabkin and Bob Martuzza together. They were partners. Bob is obviously the chair of our department. And I really saw the full possibility of being part of a team that was doing like real clinical trial history, answering questions about basic immunology and virology, and also like bench to bedside work at the same time. And, you know, spent the dedicated 2 years there, had a real picture of what it took with like the actual rigor, and understood the frustrations and the successes and the joys there with that dedicated time. And then through really Dr. Martuzza's mentorship and the opportunity he gave me to stay on staff with another great mentor, Glenn Dranoff, who taught me all about immunotherapy clinical trials. So the whole pathway I just outlined about 4 and like 10 years there, 10 to 12 years, was facilitated by like, just my basic interest in improvement, but like 3 to 5 like really great role models and people that took me under their wing, actually like believed in me and kept passing me along to for opportunities. So that was the pathway. But that's why, like, if you know, when I was in college, I was a history major. I was just very happy to get into medical school anywhere. And then same thing with matching into residency. But it was like my evolution was heavily influenced by people impressing me with their dedication and what they brought in terms of wanting to do better for our patients. And then just kind of running with what was provided for me.
Yeah. One follow-up question to you, Will, is, you know, did you find that there were certain doors that either Dr. Dranoff opened for you, or, you know, because we talk about the role of a mentor as an advisor, but were there times when you felt like, wow, that mentor actually created an opportunity or opened the door, and maybe if you could just specifically comment on that?
Oh, absolutely. I mean, what Glenn was able to do, Glenn is not a neuro-oncologist, right? He's not a neurosurgeon. He's an oncologist with great experience. But I think the number one thing was that, besides just my affiliation with him, was that he created a clinical trial protocol. And the reason I stayed to work with him was because the opportunity to run a clinical trial, like several years into my career, a cell-based immunotherapy clinical trial, and having that opportunity under his tutelage and using his resources was just incredible. And then there's also a certain two things I think are currency in terms of credibility in the scientific fields in general. And one of them is actually having funding and grant money, right? That kind of gets you into a collaborative conversation. But in the absence of that, or in the early days of that, it's also kind of like who you know and who you've worked with and who vouches for you, whether it's directly or indirectly, just by saying, hey, I'm part of the Dranoff team. So
yeah, no, I love that. I love that story of getting you involved in that immunotherapy trial. And I think I remember those days when you were first connecting with Dr. Dranoff, and you know what a powerful influence he was. writ large in the field of immunotherapy, but your application of that in the CNS tumor space, I think was early and special. So back to Dr. Chiocca, origin stories about, mentors who, influenced you or perhaps gave you advice that you might not have otherwise known about, and opportunities. We'd love to hear about that.
I know that's a great question. It brings me back to my origins. As you know, I grew up abroad and really came here to go to college, kind of a college migrant, right? Which is how this country was built. And, went to the University of Texas in El Paso, Texas. And El Paso, being a border town, was a great town to be in for a few years. Not truly an academic powerhouse, but I really became interested in science because I didn't know much about science, but there was a chemistry professor that we used British, and he really took an interest in me personally. He kind of, I worked as an undergraduate in a chemistry lab, and I got really interested in chemistry. And he said, "You should come and work in my lab." And then I spent about a year in his lab with, this is just a really dirty chemistry lab. If you think about it, there were fumes everywhere. I can't believe I didn't get cancer because I must have swallowed so much stuff or infused so many fumes. But he really believed in me. He was, you're young, you don't know much about yourself. You really don't, you're very insecure. You have, a total inferiority complex. And he really believed in, no, you're smart, you can do this. And I wanted to go to med school. He said, you can do it. And he pushed me actually to apply for a summer undergraduate program at MD Anderson because I had no expertise in biomedical research. And I went and spent a summer in this lab at MD Anderson where I met another very junior person who was studying prostate cancer. And he also took an extreme interest in me and my development. And I remember spending days and nights in his lab all summer, learning how to do 2D gel electrophoresis, and which was what he was doing. He was comparing prostate cancer.
I just have to interject. I never knew that about your early career because we share this prostate cancer heritage.
Yes.
I'll have to come back.
My first paper was on prostate cancer, and he was doing 2D gels, silver stain 2D gels, comparing normal prostate to prostate cancer. He was in the urology lab there, and I just worked all summer. And then I went back there in the wintertime. I stayed at his house, and I would just spend 20-hour days in the lab doing this. And I was totally enamored with biomedical research. And he really took an interest in and put my name in the paper. It was not a great paper, but that's really got me all excited about science. So those two early individuals who are really not well-known people, small labs, but just spent time with you, spend time with me. And, there's sometimes you go and work in big labs with big name people and you just never see the PI. But these were small labs and they really kind of believed in me and really pushed me. And I think that really helped me kind of get a little bit of certainty about myself, about my abilities, and got me moving towards go to med school, actually going to an MD PhD program.
Love that story. That's fantastic. So, the theme, the takeaways are, the powerful early career, even small deviations in one direction or another by a mentor can set you up for big inflection points later. I'm going to talk, you both have had distinguished discoveries and developments in your scientific careers. I want to talk a little bit about, I think Will hinted at this, some of the joys and some of the tribulations of a career in science. And so we're going to come to the tribulations later, but we're going to start off with the joyful part. And maybe if you could tell me, both of you, maybe we'll start with Nino, about did you have a eureka moment in your career or moments? Or did you have a particularly joyful moment where you said, wow, this was just something special to me personally? And what was the sustaining value of that moment in relation to, you know, what was to come later, which would certainly be some tribulations. And, you know, maybe if you could both speak, and you can dig into the specifics, because I think we're all interested to hear about the science that you've contributed to. But if you could talk a little bit about perhaps a eureka moment or a joyful moment, I'd love to hear about that, you know.
Yeah, I know there's several. I'm not sure they made a great deal of science, but there were several in the sense that there was an hypothesis that we had, and we went out and proved it. And I thought that was an amazing eureka moment. So that's on the science part. And then I think there's a second one, which is seeing people in your lab go on and succeed later on as faculty members. And I can think of a couple of those. But in terms of eureka moments, there are a couple from early on in the career. One was being able to show that a particular, one of the things I work on have been gene therapies and oncolytic viruses. And this seems like a small deal, but early on we decided to work on an oncolytic virus called herpes that was based on one of my other mentors later on, Bob Martuzza, and in finding that we could actually make this virus more powerful, going a little bit against the paradigm. The paradigm was to remove a gene from herpes that causes encephalitis. But we actually decided to do the opposite, to leave that gene in, but just put it under transcriptional control of something that's expressed in glioblastoma.
Was that your Nestin construct?
Yeah.
Oh, yeah.
Yeah, it was earlier on, it was a MIB construct. And there was a young, actually a neurosurgeon resident named Richard Chung, who worked in my lab and showed that was possible. You could do that. And not only showed that, but it showed that it was actually a very potent oncolytic virus that you could use in immunotherapy. And that kind of, that paper and showing that really expanded its entire area to the point that we're now in clinical trials, now 20, 25 years later. I mean, things have changed a bit, but that was one moment, seeing something that, an idea in your lab, and then being able to translate it all the way into clinical trials in humans from your own discovery, I think was great joy. And it's interesting. I was speaking to Dennis Selko, who's an amazing Alzheimer's clinician scientist at the Brigham, and he was one of the first people to come up with the amyloid hypothesis. Now, 30 years ago, the Alzheimer's is due to deposits of amyloid in the brain, and if you get rid of the amyloid deposits, you can reverse some of the symptoms of dementia, or prevent them. And now he's in his late 70s to 80s. He had this hypothesis 40 years ago. And now that there are drugs out there that have been FDA approved that do exactly that, it's sort of like a testament to this intuition and to this finding. And he's just the happiest person because of that. And it's, it took 40, 50 years for this to be proven. And that's true about science. Sometimes it just takes a long time. And so similar thing with this oncolytic virus, even though we came up with this idea back in the last century, I must say, we haven't seen it to fruition until recently in clinical trials. And there are other ideas like that. And the second thing, is just seeing the success of some of the people that you had in your lab. I always say that the ones you mentor the least sometimes are the best because they kind of know what they're doing. And, there's a couple of them, there's one British guy that was in my lab and he kind of figured out everything on his own. He's now a full professor at Oxford, works on Parkinson's, got more grants than anybody else. And is an amazing, everybody knows who he is in the field of neurodegenerative disease and Parkinson's. But he was like that from the beginning. I knew the first day he came to the lab that he was going to be a superstar. But just seeing people like that evolve, even in spite of you as the PI, is a great joy.
Those are great comments and great thoughts. I love it. I love that. Will, how about a eureka moment in your trajectory?
Yeah, I had the chance to think about those, and they during Nito's answer, and they come pretty readily. And it also kind of shows how we all have like slightly different variations on these careers, right? And I have 3 or 4. I won't give long descriptions. One actually was when I actually realized that for the first time as an independent investigator that we had enough data to put together a paper. that was as in my lab, we did this really interesting project, first of its kind, co-injecting oncolytic herpes virus with dendritic cells into a tumor, doing it at the same time and timing it, spacing it out, and actually, like, all of the hypotheses were proven to be true. So both in terms of mechanism and outcome in these animals, and it was, you know, an interesting finding. But it was the first time, like, my own idea had come to fruition together with like the other people in the lab. That was not the paper itself, just the idea that we actually had enough to put together a paper. The others actually that come to mind are all very much in the translational clinical research realm. And I can think of 3, which would have to do with patient responses to novel therapies. And I'll just run through them quickly. One was like this incredibly difficult patient I had with multiply and rapidly recurrent papillary craniopharyngioma, right? And we were out of ideas, but we had recently done a paper sequencing cranios and seeing the BRAF mutation in the papillary ones. And so just like literally out of desperation, we tried a BRAF inhibitor and it worked like gangbusters. And so that first response and seeing that film and seeing this patient who was like intermittently comatose, just like up around, walking around, like that was a real eureka moment. Like one of the most satisfying things. And that was a very much a team-based thing. Like that
I just have to inject for all of this in the neurosurgical oncology field. That was such a great thing, you know, to see those images of that tumor shrinking and then later see that play out in a New England Journal of Medication publication clinical trial. That must have been very gratifying.
That was truly incredible. And even getting the paper and the trial in the Alliance, funded by the Alliance, like published, paled slightly, while very gratifying itself, to actually like seeing, like doing it for the first time and seeing that like revolutionary outcome. And of course we needed to sustain it and prove it in multiple patients. Then the second, and these are in no particular order, was, you know, in the vaccine trial that we were talking about, the cell-based immunotherapy with Dr. Dranoff, we had a couple in our phase 1 study, we had a couple of like real responses in these patients with recurrent tumor. So seeing the responses was incredibly exciting. But where I felt you know, validated and excited in a way was when we could see the blood serum markers of response corresponding with radiographic and clinical response. And it's just like this idea that we're actually doing something that could be positively affecting some patients in the way that we think. And very similarly, I played, you know, like a facilitating role, served as a PI in our clinical trial that you're part of with the CAR teams against EGFR-V3 positive glioblastomas. And it's just watching our colleagues, Dr. Brian Choi, who, you know, trained as a resident with us and is on our staff now, bring this to the clinic. And, you know, after about like 7-8 years of work, seeing a patient survive and actually have a response. When you see those patient responses, that's actually just like breathtaking, that you're creating something that is, you know, moving forwards the field and like doing good things for people.
Great examples, and, you know, congratulations to both of you on those signature moments. If we can talk about something that's a little harder. So we've all gotten up to the plate, swung the bat and missed, sometimes flailing wildly. We've had to recover from that, correct the swing. Can you tell us about a setback in science and how you worked through that? And I'd love to just hear a little bit more about your approach to the hard part of the longevity of a career in science. And it could be in any number of domains, whether it's experimentation, relationships, granting. But if you had a setback that you're willing to share, just so that we can all know that it hasn't been perfect the entire time, I think that would be helpful.
I'm happy to start there.
Yeah,
I have time.
please do.
It's like,
Well, you have so many more setbacks than I
I
do. So
know.
I figured
I
what
wanted to
you
get them, I
refer
want to get them all in.
to.
You know, it'd be boring if we asked you for your setbacks. It's honestly, it's continuous, you know, but the thing is, you look at, you know, actually, you know, Nino was describing his origin story and working in a chemistry lab under these like kind of like gnarly occupational conditions and working 20-hour days. But he did it with like a tremendous, with a big smile, right? That's the thing. And I can go back to early days working with Dr. Martuzza, Dr. Rabkin. I had this big, I thought I had a great idea. I won't go into the details of it, but I thought it was really novel and practical. And I did just a massive experiment, like tons of mice. This was going to be like, I had some data that was promising, but like the big home run mouse experiment, here we go. And measuring mouse tumors at like 11 p.m. in the dark, you know, your whole life. And
Flashbacks. We're all having flashbacks here.
And
Yeah.
it just like didn't work. There's like no difference between the control group and the treatment group, like at all. And that was it. That was like 2 years of idea generation, ideation, and like and we had some data and I could stand on it, but like the idea basically didn't work. And so that was kind of like I did learn a ton, right? I learned a ton about what to work on and how to conduct experiments, et cetera. And that's kind of the lesson I took from it, and I carried on. There are all sorts of things where I would go down a pathway and write a grant. You know, I focused a lot over my career in combination immunotherapies and like trying to combine one immunotherapy with some standard of care treatment that looked promising, et cetera, and generating preclinical data. But sometimes it's really hard to convince a granting agency that it's worth it, or one part of that combination is proven in a phase 3 study not to work, like Avastin in newly diagnosed tumors, and so nobody's interested in combining with anything more, and you put like 3 years into thinking about that. So there are ups and downs, some of which you can control, some of which you can't. So that's just like, that is a never-ending part of this. But if you enjoy the process, if you enjoy talking to people, right? Like that's what I said. The funnest part is like actually coming up with the ideas, and it's having somebody else think that they're a reasonable thing to pursue, and then going for it together. Like, because like there's far more things that don't work than do.
Good, yeah, great thoughts.
Yeah, I always like to contrast and compare clinical work with scientific work. I always tell people, in your clinical work, most of the surgeries and most of the things you do work out 99.9% of the time. And you usually forget about it, right? You have another good outcome and you forget about it. What you remember is always your failures, right? The patient that did badly. And in science, it's almost the opposite, right? 99.9% of the time, stuff just does not work. And it's that 0.1% of the time that you always remember. The stuff that worked is what you remember. The stuff that did not work, you kind of like want to forget about it because it was so much work and time. So it's, to me, at least personally, that's always an interesting compare and contrast. And as I tell people, most of the things you do in science do not work. You know, and I think that's what hypothesis-driven research is. You're trying to disprove your hypothesis. And so, as Will said, yeah, you thought you had the best idea on how to cure a tumor and it doesn't go away. Or you cure the other thing, you cure a tumor in one mouse model and it does not work in the other mouse model. So it has nothing to do with your treatment. It has to do with the variability in the tumors. And I can go on and on. There's so many experiments, so many reasons for that. I think sometimes you should not give up. You should figure out why things don't work. But a lot of times, maybe the best approach is just to move on to something else, just because sometimes you can spend an entire career figuring out why something doesn't work. The second area is exactly what you said, which is sometimes even though you think you have the best experiment, the best paper, your reviewers either of your paper, your grant, don't agree with you and reject you. And you know, that's always especially at the very beginning of your career, you think, I can't believe they rejected this. And this is a great finding. And others don't agree with you. So I think that's also a very sobering moment, a very humbling moment. And but sometimes I always tell people, some of the like Will probably knows this, but the discovery of T cells uh was published in a bird of avian flu or something, because they could never get into a real paper in the 1950s in a neurojournal. So sometimes just because you are not publishing Cell Nature Science, it doesn't mean that your discovery is not good. It just means that others have not appreciated the beauty of it. So I think that there's lots of moments like that. That's what science is about. It's about just a lot of failure, and you just have to deal with it and move on, especially if you love it.
Love those examples. I have one more question.
Hey,
and
Bob,
then we'll...
Bob, could I
Yeah.
make a comment about that?
Please do.
This is Greg. I just want to, I love the compare contrast clinical versus research. The one thing I would say for, everybody who's on the call, which I think are either neurosurgeon scientists or aspiring neurosurgeon scientists, is that's the beauty of being a neurosurgeon scientist or a clinician scientist, because you can enjoy the daily satisfaction of helping a patient or having, meaningful interaction with a family. And it balances out the roughness of all the research failures, and at the same time, when you get your discovery and research, it kind of balances out the individualness of your impact on clinical care, which is patient by patient and family by family. It's iterative, while a discovery can really impact, hundreds or thousands or a whole field. So doing the combination is fun, but also therapeutic, because one salves the other, and when it's not going well. So it's just a wonderful field to go into for a lot of reasons, including that little example I'm giving about the balance of the two. So just want to make that comment.
Hey, Greg, I really agree, Bob. I just want to say one thing. So one of the things I do in my job is we assess the well-being of our faculty and in our departments. So what Nino and I and Bob have been describing might sound, it is a ton of work and ups and downs and frustrations. Those faculty that actually have some balance between investigation and clinical work are the least likely to be burned out. And it's got to be related to what Greg was just describing there.
Great comments. I had just one more question for our two panelists, and then we do want to kick it out to the audience if there are a couple of questions, if we have a little bit of time at the end. You can throw those in the chat. If we can get to them, we will. Or alternatively, raise your hand. But here's that last question. If you're willing to share, I think every individual brings a certain set of talents to their activity, and there's some that they maybe naturally feel very comfortable with, others that they learn. I was asking Dan Yoshor one time, who's a chair of neurosurgery at University of Pennsylvania. And he said, Dan, well, what's your secret to success? You're a neurosurgeon scientist. And he says, well, for me, it's to be relentlessly organized, and that was his superpower. That was what he brought to bear to try to develop his life and his career and his professional arc. So I'm wondering, have you each developed either, expanded on some talents that you felt like you had early on, or are you willing to share some tricks of the trade or even a superpower that you try to deploy to give yourself essentially this professional success that you've enjoyed, and both of you have made so many contributions to our field? And it might seem like a little bit of maybe a self-reflection and perhaps a little bit of hubris, but we want a little bit of hubris. We want to hear a little bit about what you've been able to do, or what are your tools that you're using to achieve in the way that you have. Tough question.
No, I think what Dan said, being very organized is key, especially with busy careers like ours. Not getting caught flat-footed or unprepared, always thinking ahead. I mean, you have to do that, especially if you're submitting grants. The NIH has certain timelines and timetables. You can't submit at the last minute. You have to do that if you're preparing for surgery, for an operation. You got to think about all the things you need and all the preoperative studies and talk to the patient expectations. So you have to be extremely well organized, I think, to do what we do. I think that's comes probably with our phenotype as neurosurgeon scientists. I think it's embedded in all of us. I do think I spend a lot of time in reflection and trying to figure out exactly how to best approach a problem over time. It's a little bit like chess, thinking of 10 moves ahead of time. Sometimes that gets you in trouble because you don't know what the moves are going to be that Deep Blue, who you're playing against, is going to do against you, or what life brings you against you. But I think trying to prepare and trying to think of every eventuality, possibility, whether you're doing an experiment, if you do this, what's going to happen? If you do that, what's going to happen? Or whether you're doing an operation, the steps that you do in the surgery and what are the steps going to lead me to, or whether you decide a course of treatment for a patient. There's always multiple possibilities. What is this going to lead? So I think thinking through carefully about each plan, I personally think it's served me well, but it does take time for reflection, time for insight. And, I find myself always thinking the best, for example, while I'm exercising. That's a lonely time that I can just think. And sometimes I have my best ideas and sometimes my worst ideas when I do that.
And I know that you're a big swimmer, so that might be coming in the pool, I guess, or something like that.
Well, there's nothing about being in a pool by yourself, just water sloshing around. You got to think when you do that, or else you get very bored.
I love it. Will, thoughts on that?
Sounds pretty boring to me.
That notion?
I think
Will is a golfer. I'm not sure. How do you think of?
Well, golf, the thing about golf is I don't think about anything else. When I run, I'm forced to think about everything else. That's when I reflect. But it's a great question, Bob. I think that I think I learned organization really in medical school. So I think like how to organize my learning, what kind of learner I am, how I move my knowledge forward. And so I think most people that get to become neurosurgery attendings have that in them. But organization is quite important to accomplishing things in our busy lives. But I think that it is like this combination of it's like an oxymoronic almost. It's like humble ambition in a way, right? Which drives like curiosity but you also have to have the belief in yourself. And I believe in myself, but I also believe in like everybody around me that with focus and interest, we can like learn and pick up and accomplish anything if it means enough to us. And then if you set goals for like where you want to be, and then this is where the humility comes in, like honestly reflect on how you're doing and how you're performing, or like be very open and outgoing about seeking other people's appraisal of how you're doing, and if it's negative, not letting that stop you, but like taking stock of it and changing your pathway. So, like I was kind of saying, I was a history major in college. I didn't have any designs on having a scientific laboratory, a scientific career. I wanted to be a surgeon. I didn't really understand everything. But once I saw people that were doing it, and I saw what patients with cancer were going through, like I couldn't help but want to be that. And so I sought the mentoring and did the book learning and did the fundamental experiences that got me to where I wanted to be.
I imagine that must have helped when you decided to take on the CMO role, that notion of, I'm going to tackle an entirely new problem set, and having that confidence that you had the skills. You didn't have the technical details right at the beginning, but you had a set of skills that you knew would allow you to be successful and in fact want to take that on.
No, completely. And that's why I think being a neurosurgeon is good preparation for these sorts of changes if you want to do it. And I can it's like I knew that I could learn new things right? I knew that I could work with people and learn from them. And I could like read as necessary. I also, if I go back to being a PGY6 and I was doing a case with Dr. Chiocca, and I was like, God, I'm really struggling with this tumor. Am I ever going to be able to do this by myself? But there were things in my own background that I knew I could do that I've had accomplished things in the past. So you just like kind of know that you can figure it out over time.
Great.
Because there are lots of
I didn't take the case away from you, Will. I don't remember.
Yeah, no, you said, Will, you're gonna, that's the internal capsule right there. I was like, oh, I have no idea. Like, I had no idea. So that I assume you took it away then. But that's my strongest memory is like, oh my gosh,
I don't remember that, but that shows you.
Capsule.
Wow. Well, this has been terrific for me. Just learning so much more about colleagues and friends. We do have a couple minutes. If anyone in the audience has a question that they'd like to address to our panelists, feel free to jump in or raise your hand. But I just want to, as a preview, say thanks to Greg and the team for organizing this seminar series. It's absolutely terrific. Part of this is about building community, having people that you can lean on. And if you were to do a screenshot of this Zoom call, there are a lot of people here who are interested in seeing the collective success of the neurosurgeon-scientist, the neurosurgeon investigator, the individual that wants to be research-informed and research-infused care to our specialty. So it's really been great to be with everyone tonight.
If I can say something, one of the things that Greg and everybody, this is so important. When I was your age, we didn't have this, and you really felt kind of almost unique as a neurosurgeon-scientist. Some of us called us rat neurosurgeons because we did rat experiments of mouse neurosurgeons. So it was almost disparaging. So I think having this community to show that you can do that, you can be a great clinician, great surgeon, as well as a great scientist is so important. So thank you.
Thank you. Greg, kicking it back to you for any closing comments.
Yeah, maybe just one question and then we can close. It would be interesting for me to hear, Nino and Will, your thoughts later in your career when you started thinking about these new roles, being a chair, directing a brain tumor center, directing a cancer center, doing the CMO role. I mean, these are different than most of what we've been talking about, being a clinician and running your own research program. What were your thoughts about that? Why did you choose to do those things? What brings you gratification, and why did you take those on? And then what were some of the sacrifices in a short last couple minutes? Maybe start with you, Will.
Yeah. For me, it was very local, and it was wanting to just have a different kind of impact, like being exposed to that impact or that potential, and having an impact on more than like you want. It's very similar to research, like good research, more than one person at a time, right? Impacting populations of patients and supporting all my colleagues in all their good work. I can really feel that palpably. And I really enjoyed the experiences that I had as a neurosurgery attending, doing research, and as a clinical leader, and bringing people together to solve pretty complex structural problems. And so just the chance to scale that was really, really exciting to me.
Yeah.
The question about sacrifice though, Greg, I do miss some things. I do miss, if I ever feel guilty, it's actually that I'm not doing more research now, because the research problems are so top of mind, right? And so urgent, right? That I do sometimes feel that I should be spending more of my time on these issues. But I really would like, it's important to me to leave something better than how I left it. And hopefully I've been able to do that in a couple of different domains.
Yeah, that's great, Will. Nino, the last word on this.
Yeah, I decided to become a chair at a very relatively young age, and I did it for all the wrong reasons. I decided to become a chair to extend my research career, to basically get more lab space, so I could do more tumors, so I get more money for my own research. And as soon as I became a chair, pretty quickly I realized that that was a recipe for disaster, being a chair. And it wasn't about me, it was about everybody else around me and to grow everybody else, even if I wasn't growing myself. And so it did put back my research career because I could not spend as much time on my research career. But I think helped me become successful as a chair and seeing my department grow and get strong and faculty grow. So I think that is something that people always have to think about as you take on leadership roles. And all of a sudden, it's not about you anymore; it's about everybody else.
Great comments. This has been a lot of fun. Really appreciate everybody joining with us for this session.
Thanks, Bob, for leading. Will, Dino, thanks for
Greg,
doing
Dino,
this.
thank you very much.
Yeah, have a wonderful night, everybody. Thank you. Just so you know, the biggest audience we've had. So congrats.
All right.
Must be the
Star
other
power,
comedians.
guys. Star power. Great job.
Thank you.
Thanks.